Yes, hello. Good evening. Okay.
Good evening, sister.
Sister.
Good evening. Good evening.
Okay. Thank you. I hope you're all doing well. All right.
Yes.
So whilst waiting for the rest, please let's start. And because today we have, I want us to treat two main major topics. Okay. So I think last week we started with domestic violence and most importantly, intimate partner violence during pregnancy or in pregnancy. And I remember I explained that being midwife, why please, I'm begging those who are fond of just leaving their mic on, please don't start so that we can have a smooth discussion to the end.
Please, our books. So,
Hey, which group is that? Which one? No, center.
Please, Takrade.
Oh, okay. I communicated with your coach rep today. Um, so it will come. Yeah. So please be conscious of your minds. I'm begging all of you so that we can have a smooth discussion and we can complete on time. Okay. So like right here, I said domestic violence, and particularly we are looking at intimate partner violence during pregnancy. So from there, I want us to today also look at respectful maternal care. So that is violence, that is it disrespect and abuse, and then that is respectful maternity care or maternal care. All right. So I think last week we had a discussion. Unfortunately, I was having a big challenge with my laptop, so it couldn't sustain the that is our meeting for us to finish. Okay. So I think, like I rightly mentioned, there were discussion, a fruitful discussion. So the point is, the first thing is that why are we learning this? Because we are midwives, and somebody will ask, why does this concern us? It concerns us because, as part of our care, delivery of care, and even sometimes, even those who are also tutors or in the classrooms, it's also important so that sometimes we can recognize women, especially, we understand the physiology of pregnancy, both the physiology, the psychology, the psychological part of pregnancy and childbirth. So, and even in preconception, next week, God willing, we will deal with maternal mental health. So what happens is that psychological effects, or that is negative psychological impact, also affects the even pregnancy, and we can all attest to it. So as in midwives, we are also primary caregivers. So that's why it's so much important so that we become in our assessment when we are dealing with these women during the reproductive period, even when they come for family planning. Because I have witnessed, in fact, sometimes when you talk about this, you become emotional. I have witnessed a woman at the family planning unit where, in fact, she didn't really consent. In fact, she doesn't even want to do it. But then the husband just dragged her to the family planning unit. It's like whether she likes it or not. And she's also going to do BTL. And it was a whole lot. And then unfortunately, as part of it, like I said, we learn it so that as midwives, we know how to handle the situation. Because I was there, and probably the way I would think that much as the man was become abusive, and then that is forcing his way out. The midwife to, I think, out of frustration or something, also couldn't. Please, can somebody be co-host for me so that she'll be removing those people who are not willing to listen and are disturbing, please, so that you just take them away from the platform, because sometimes they are not ready to learn. Okay. So yeah, so one thing that we should take into consideration, maybe you will think, oh, me, because and especially in our part of the world, it's very if you don't apply wisdom, if you don't become tactical in your dealing, in fact, sometimes they will even leave their wives or their partner to come and even hand you the midwife, especially those are the chiefs and then the health centers. So that is so much important. Yeah, much as we want to help, we also have to be very careful. Also, like even yourself as the midwife, in order not to be targeted and also maybe sometimes be harmed. And one thing that in Ghana, or even you will get the statistics, in Ghana, these things are not reported. In fact, the cases that even gets to the police and then those in Dovsu and the rest are not even compared to those that are not reported. But then what I want us to draw our attention is that one thing is that domestic violence is a human rights violation. It's a human rights violation. So that's why we shouldn't take it kindly or lightly, and especially for the category of women that we handle or that we deal with. Okay. So that's been said as an introduction. Like I said, one thing that we should recognize is that it's a violation of human rights. So most of the time, it's against the human rights of the sufferer or the one who is being abused. Okay, all right. So let's see. Let's go into it. So it's in the book, but then I also have slides with some additions that I will share with you later on. So intimate partner violence, that is the IPV, as way of defining it, is a pattern of coercive control of one intimate partner by the other that includes physical and sexual violence, threats of physical or sexual violence, and emotional abuse in the context of physical and sexual violence. So because the word intimate, so that person is you are in an intimate relationship with that person. So normally and most commonly, it has to do with physical. The abuse is in the form of physical or sexual violence. And then the abuser trying to also exert control over the other. So one thing is that much as sometimes statistics shows that is women who are of majority, that is who becomes those who are sufferers, that is women are of majority. Unfortunately, that is it can go either way. It can either be the man. Sometimes men also suffer abuse, yeah, or they also suffer intimate violence. But with statistics so far, it's women who mostly become the sufferers. So with perinatal intimate partner violence, that is between conception or pregnancy up to 1 year postpartum, that is the perinatal period. So we are seeing a violence that occurs before, during, and after pregnancy up to 1 year postpartum, and is committed by an intimate partner, such as a spouse, ex-spouse, boyfriend and or girlfriend, or ex-boyfriend or ex-girlfriend. So it is a pattern of abusive. So the point is, it's a pattern because it's not just a one time, definitely most of us, definitely one way or the other, either verbal abuse or something. But that one sometimes maybe due to disagreement or something. But then this one is a pattern, like the abuser find it like it goes on for some time. Yes, abusive. So it's a pattern of abusive behavior by a current or former spouse or intimate partner that's used to exert power and control over another person, and it is against the law. So like I said, it's a human rights violation. So that's why we shouldn't take lightly with it. And as health professionals and as midwives, you should help to control, at least to help those who are suffering, that is the sufferers. So types of abuse. So we have emotional, like I've told you. So can be in the form of repeated verbal attacks. So normally for the emotional is something that will really dampen the spirit of the sufferer. So mostly the woman. So like repeated verbal abuse or attacks can be coercing, can be coercing her into doing things that she may find humiliating or against her moral or religious principles. So it becomes so bad that it's like it's normally humiliating to the woman. Recently, I remember like I've taken her as a friend or as a sister for can you take this person off? Yeah, I think Safwa, I think you should, you are the co-host, and I think Rebecca too. Please, I'm begging you kindly, and even Alice, you are the host. So kindly monitor these things for me, so that I don't have to, it doesn't have to be back and forth for me. Okay. All right. So talking about emotional abuse, then we also, so normally it becomes so humiliating for the other partner. Like I was telling you, about to tell you of a more like a sister to me, or like because of her closeness and then her trust to share some of the things that she goes through with me. It's like, though they are married, but due to one issue, like the husband wants her to, when she after 3 children, and then when she became pregnant again, the husband wanted to commit an abortion. And being a Christian, and is and being a Christian, and like when she's sharing with me, you could see the emotional trauma that this woman has gone through. And then the threat. So the threat actually was so much that she has to succumb to that. That is the suggestion or whatever the husband was telling her. Okay. Then we have isolation. So Barbara finds fault with social contact of the victim. So she ends up with nobody to confide in. So normally these people don't use those abuses. In fact, they normally doesn't want you to come close, even with your own relatives, your close relatives. It's like they don't even want you to come close to them. And normally they try to find fault even when the person is on phone. And sometimes these people, what they do is that they even seize their phones. So once they are there, they will not allow the woman to use phones if they are alone. So unless, for instance, if they return back from work and they are with them, so that they can monitor whoever they are talking to, whoever they are chatting with. Yeah, so it means that is, so we that is also a form of abuse, that is isolation. So they try to isolate them from anybody that they can confide in by sharing whatever experiences that they are going through. Then we also have threats. So threats to harm the children, threats to harm even the woman herself. And we also have gender role stereotypes play a dominant role in battering. So they are perceived male privileges that enter into the relationship. So here actually gender role stereotypes, and especially in our part of the world, African, where it's like the man, we have a well-defined role for the man, where the man can always have his way, and then you, the woman, you are supposed to submit, like you don't have any say, like the man takes control, everything, that is, he is in charge, and you have to submit, irrespective of whatever the woman will be going through. So for instance, example is forced sex because it is her duty. So, even when the woman is in pain or something, because the woman is like, excuse me to use the word, like a slave. So whenever the man wants to have sex, he has to have his way in the woman. So whether the woman is cooking, like anytime he wants it, he has to find or have his way. Then we have economic abuse. So for the economic abuse, like victim has no independent access to money, even if they are working. The spouse may harass them to the point that they turn over their paycheck as a way of avoiding further abuse. This limits her way of getting out of the relationship. So they try to seize everything from the woman. So it's like you can't do anything without the man or the abuser, and it limits the man. So one thing is that they do that so that they will have already, with expect that it's a way of control, exerting power. So it's like the man, the woman can't leave the relationship because Oniska or so that's why most of the time they tend not to report, because okay, we'll report it now, say chip them or they do something to the man. She doesn't have any means of living, because already, for instance, in the case of isolation, already maybe the man may have let her isolate herself even from her family, so she doesn't have regular contact with her family, and because they don't also know what is going on, they tend to maybe turn their back on her at some point in time. And I remember one lady, I think she's a past student. In fact, some incident happened. So she has to call me, and then for me to help her out. And in fact, for throughout the conversation, this lady was just weeping profusely. So all because she got herself into trouble, all because of the abusive relationship she's in. And as she narrates her things, it's like she was just crying. And I remember I told her, what about your family, your parents, your mother? And she said, Doc, I only have my mother. And then my mother, because of the abusive nature of the husband, and because it's like the husband is the one in control of finances. So the mother said she should keep quiet and then live with a man like that. That's how she also whether enjoyed, you also experience her own. So she doesn't come in. And to the extent that even the pastor, so I told her, so I even asked a whole lot. So even your pastor, she said, Dog, our pastor, because our pastor said it one time, he stopped going to church. And because he stopped going to church, and I think he has even warned the pastor. So the pastor too can't even come in to even address anything. So, it's a whole lot. Okay. So let's go on. Then we have sexual abuse, includes rape, as well as forcing her to perform sexual acts that she may feel are immoral. So we have some women that definitely you have your preferences in terms of when it comes to sex. So these people may want you to do something that will humiliate you, whether you like it or not. So then we have what we call reproductive coercion. So reproductive coercion actually has to do more with the perinatal abuse. So so this is so threatening to hurt them if they refuse to become pregnant. And reproductive coercion is really found in our setup here, especially when the woman is found not to conceive or not to be able to conceive after maybe a year, even a year, sometimes 6 months, after 3 months, so here in our setup part of the world where we cherish in-laws, cherish children. So it's like when the woman, after whether even it's the fault of the or the fault like they wouldn't even take their time to even find who is at home. But once you get married and there's no children, it's like the fault of the woman. So reproductive coercion should threaten to help them if they refuse to become pregnant. Meanwhile, maybe it may not even be the fault of the woman. Use of physical or economic control to prevent the partner from obtaining birth control. So the intimate partner, so here the reproductive coercion here is like the maybe in terms of maybe the woman, maybe for instance, in the case where the woman too has given birth plenty and you want to control the birth. So because maybe sometimes there was a story I heard that the man said he's the only child. So if he's the only child, he has to give, once he gets married, he has to give birth to, I don't know how many that he wants. So as much as he can produce, or that he doesn't even care for the strength of the woman, he doesn't even care for the strength of the woman and all that he knows that we have to give birth because I'm the only child of my parents. So they continue, so they use these means, that is physical and economic means, to control, to prevent their partner from even obtaining birth control, so that they can then hiding or destroying birth control, accusing partner of infidelity if they want to use contraception, and then accusing partner of not really being in love if they don't want to become or remain pregnant. So they will do all sort of things, like they all that they want is that the woman should continue giving birth, or the woman should become pregnant, irrespective of the health condition. So they use violence or threaten violence to convince partner to continue or end a pregnancy. So sometimes too is the other way. Sometimes if they don't want the pregnancy, they also use threatening means to let the woman terminate the pregnancy. So physical assault in order to induce a miscarriage. So for the reproductive coercion is in either ways. There are some who want the woman to get pregnant, but they are not, or maybe they want more children, and then the woman, because of her strength, because of the experience that she's been going through doing childbirth, maybe she feels that she's tired, she can't give more. But then this man will still insist that you have to get pregnant. So doing all sort of things. And then there's also another one who also doesn't want the woman to become pregnant, and therefore also applying all sort of physical and then economic and then sexual things. So for instance, here for the physical assault, sometimes the woman may be pregnant, but then they will beat the woman, they will assault the woman to the point that the woman may start having miscarriage or will start bleeding. So forcing the partner to have multiple pregnancies with within a short time so that she's unable to work outside the home. So, you know, these abuses, so that's why sometimes they say that those people have psychological problem, because the point is that they will do everything that they know to restrain you from either, like in terms of isolation, to isolate you in terms of economic, so that they will drain you to the point that you are so much dependent on them that without them, it's difficult to even survive. And because of that, you are unable to leave the relationship, though they might even be assaulting you physically. So that's how those abuses, that's how they behave. So we for these statistics, unfortunately, so let's look at the statistics, but we are not going to use this one. So in the first place, like I said, not all intimate partner, that is the intimate partner violence, is reported to the police or to those organizations that we have in Ghana, even not in Ghana alone, all over across the world. So because of, like we've read, that is, we've learned about the types, because of they put in all these measures like economics, so you don't even have the means to even go to the police, you know, and you know, going to police station is all about money. Going through DOPSU and all those organizations is all about money. So they drain you to the point that you can't even go and report. Then seizing your phones and they monitoring your conversations on the phone. So it leaves a woman with no way to even go and even make reports. And sometimes even when they will go into the public, it's like they are stalking them. It's like they will make sure that they monitor each step of that is, they monitor their steps so that they don't even attempt to even talk to anybody or even do anything to, in a way, to escape. So, however, we are saying that, like I also said that, however, that is intimate partner violence, it can go either way. So it can be a man or it can be a woman. But then, like I mentioned earlier, statistics have shown that most of these are actually, most women are actually affected so much. Then the WHO reports that domestic violence against women ranges vastly in cultures that are associated, that we are associated with. So, like, you know, definitely, which is clear, because even within Ghana, we have some cultures, we have some ethnic groups where, in terms of abuse, they are even more higher than other cultures or other ethnic groups. Okay, then even across the world, that is, statistics shows that, in fact, in Japan, they have only 1% intimate, they experience only 1% intimate violence, that is intimate partner violence, that is in Japan, as compared to other Africa, that is other countries, including Egypt and Africa, where we have higher percentage of intimate partner violence. Okay, then there's also differences in terms of ethnic groups. So in terms of ethnic groups, the report also indicates that minorities, that is ethnic minorities, that is, for instance, among Blacks or Africans, experience a higher prevalence of intimate partner violence than those who are not minorities. So in terms of even those living in these advanced countries, definitely among their statistics, it's mostly those who, that is the Blacks and those minorities, they experience higher abuse. Then there's also, in terms of that is, so these abuse, actually, why these abuse are higher in minorities, that is ethnic minorities, compared to those who are not in the minorities, as a result of those women actually experience or they become victims of rape, physical violence, and or stalking by intimate partners, as I've already mentioned. There are also reports of higher prevalence of intimate partner violence among between ethnic minorities, as I've already explained. Okay. So why is actually higher in ethnic minorities? It's actually as a result of substance abuse. So unfortunately, among these groups of people, there's high incidence or cases of substance abuse, unemployment, education, low level of education, cohabitation. Like most people, they are not married, but because maybe as a result of pregnancy, then they go and live with the man, and then because probably the man may not be 100% independent, then it creates this violence. And then cohabitation of unmarried partners, unplanned pregnancy, and then low income resource or low income source. There are also reports that indicates that lesbians and bisexual experience much more physical and sexual violence than heterosexual women by intimate partner violence. So by intimate partners, sorry. So even those who decide to become lesbians, so this is what statistics shows, that even among the lesbians and those bisexual, physical and the intimate violence are higher compared to those those who are heterosexual, those who are heterosexual. Okay, but please also kindly check your mic. Okay, so here, okay, for in the other advanced countries, it's like they have been able to even calculate the cost, because for them, some cases are being reported to the police, so they are able to calculate the cost, and with the cost, it's like it costs the country so much when there is intimate partner violence. Okay, so let's look at the risk factors. So risk factors include single, separated, or divorced, because we talked about the ex-partners, they also inflicting or causing violence. Then poor self-esteem. You know, there are some women who maybe because of low educational background, or not working. In fact, and especially it's mostly seen among those who do cohabiting. I know those in fact, if you are a person who is well educated and living independently, sometimes these things doesn't happen. But unfortunately, even among nurses and midwives, some of these things happen. Then family history of violence. So unfortunately, if you have this history in your family, like I told you about the lady, in fact, that her mother was able to tell her that that's how she also suffered in her marriage. So unfortunately, she has no help for her. So she should humble herself and then go through those experiences. Much as is not palatable. So family history of violence. So that's why we need to, if you're a Christian, you need to pray to break these kind of things in the family. And if you're a Muslim too, you also need to pray against these things. Then pregnancy is a significant risk factor. And it is also reported that 20% of pregnant females are victims of domestic violence. So, and I've already explained it in the reproductive coercion. So either the woman is not getting pregnant and we want the woman to get pregnant, either we don't want the abuser don't want any more pregnancy and the rest. says that 50% are victims of domestic violence. Then alcoholism is frequently involved, but it is felt to be a consequence rather than a cause. So much as alcoholism is a cause, but then how I think is either ways. So alcoholism is actually a cause of it, and then it also becomes it's a risk factor, and it also can become a cause that is as a result, that is consequence of abuse or domestic violence or intimate partner violence. Then characteristics, let's look at the characteristics of the abuser. So normally they have a cruel nature. So like I said, for them, I think they have some psychological problems. So, or they have mental problems. So cruel toward animals. So, so that's why when we are going to marry, and then you check the background of the man, and then you maybe the man will be telling you, or maybe even if you'll be there with him, and then if there's a goat or something like even these friendly animals, they come around and he will be throwing stones at them and then trying to hit them, then you should be careful. Okay, so cruel toward animals and or children, and then he uses playful force in sex. So much as it's like in a playful way, yet it's like he is trying to force his way during sex, then threatens violence or punishment. So the abuser, they normally threaten violence or punishment. And normally it may not even be you, but then you will see some signs. Maybe he may be talking with somebody, a friend, and then all of a sudden it's like he becomes angry and then throwing tantrums and then trying to maybe fight his way even in public. Then you have to be careful. Then believes in rigid stereotypical gender roles in a relationship. So a man who thinks that as for a woman, maybe you are having conversation and you think that as for a woman, you have to even kneel down when you are talking to me, or you have to wash my feet, you have to serve me, you have to massage me. Like if somebody believes in these things, then you have to be careful. Then he uses force during an argument, which I've mentioned already. Then breaks or smashes objects. Then is unemployed. So most of the time, those who are unemployed and all displays highly controlling behaviors. So these are characteristics of those abusers. Then has a limited education, because normally the more a person learns, the more the person is able to become reasonable in his thinking. So he's unemployed, he has limited education, and uses illicit drugs, has the availability of gun. Okay, so this was a study. Uses reproductive coercion. So like you've talked about reproductive coercion. So let's look at the victims. So normally the victims, they have low self-esteem. Maybe low self-esteem, maybe because of the educational background. Maybe they couldn't go to school. So once she is married, it's like she's so dependent on the man. And then emotional and economic dependency. So it's like she's somebody who doesn't have anybody. So emotionally wise, she doesn't even have friends to even talk to. And then economic wise too, she's so dependent on the man. Continued faith and hope abuser will grow up. So sometimes, obesisa, obesisa. Now, unfortunately, with the faith, with the hope that the abuser will grow up. Unfortunately, we don't marry a boy, we marry men. So if the person hasn't grown up, then there's no way he will grow up when you marry the person. Then depression. So people, women who are already depressed, young, poor, and Black are at higher risk. So that's this from a study. Then stress disorders or psychosomatic complaints, accept blames and guilt for violence. So these are most of the people who, that's why they don't, that's why they don't want to report. Because you can see that these characteristics are people who have low esteem of themselves. So they are even scared of even going out to even report. And sometimes they already have some psychological problems. So it's even difficult for them to even voice out their fears. Then accept blame and guilt for violence, socially isolated, believe social myths about battering. So this person is like, she believes, and I remember last year or so, the student that I was supervising, one of them she did a study on domestic violence, and she some of them. And in fact, surprisingly, some of the answers, information they gave was like, it's normal. Some people believe that, oh, as for a woman, at least it's normal for your husband to beat you. And is so these are some of the beliefs or the social myths that some people have actually come to believe. Okay. And then we also has poor self-image. And I think I've already talked about contemplate or attempt suicide, participation in taking order battering, then appears nervous or anxious, may defend any criticism of abuser. So sometimes, surprisingly, there are those who are victims. They will even go at a long, that is, they will go out even to even defend their husband. Oh, he didn't mean to even hit me. He didn't. Meanwhile, you have bruises all over. But these people, they will go a long way to even defend their abuser or their partner, all because of the type that we look at, the emotional aspect, the isolation they've put them through in terms of economic. They've limited them so much so that, in fact, the woman can't have any freedom. So it's like they wouldn't even allow you to even talk about the abuser and what he's doing is no good, but then they'll even be defending him. Okay, may have repeatedly left or considered leaving the relationship. Okay. Then common effects. So common effects, so the effects that normally it have on the that is the abused or the victim. So acute or disorganization phase. So we have it goes through phases, so may last days or weeks. So in the acute and then disorganization phase, we have generalized pain throughout the body, eating or sleeping disturbances, emotional reactions such as anger, fear, anxiety, guilt, humiliation, embarrassment, then self-blame. So normally these are some of the effects. So they blame themselves. Then mood swings that maybe they may be the cause. That's why they cause it, or they are the why, that is the reason they did something and then they deserve to be beaten or they deserve to be harassed or assaulted. Then we have delayed. So that's in the acute phase. That is a common effect. Then in the acute phase, we have what we call delayed. Delayed. The next phase is delayed or organization phase. Often occurs weeks or months after experience. So there's flashbacks or nightmares. So the victim experience flashbacks or nightmares of that is their experience. There's also phobias. Phobia is different from fear. Phobia goes extra and it becomes psychological, or it becomes a psychiatric condition rather than fear. So this woman in the delayed stage where the abuse has gone on for a long time. So when it delays, then she enters, so the victim develops phobia, then somatic or gynecologic symptoms. So and we all understand somatic. So sometimes there are no symptoms specifically, but then this person has developed phobia that she thinks that there's something wrong, or she's experiencing certain symptoms. Then post-traumatic syndrome, the PTSD, post-traumatic, that is traumatic syndrome. That is for the long term, when that is where the abuse has gone on for a long time. So so for a long time, so consequence of sexual assault, that is after months or years after experience. So the victim may experience symptom cluster involving re-experiencing the trauma. Then avoidance. So the person begins to avoid even almost everybody, and state of hyper arousal. So here the person becomes so easily aroused with whenever there's any, or she's going through any of the experiences. Then alcohol and drug abuse. So for some, they tend to abuse alcohol and then even drug, even when they are even pregnant. Then we have what we call battered woman syndrome. Battered woman syndrome actually is a group of usually transient psychological symptoms that are frequently observed in a particular recognizable pattern in women who report having been physically, sexually, and or seriously psychologically abused by their male domestic partners. So these it's a group of actually symptoms, and they are actually transient. So they are not permanent, or they are not chronic. So they are transient psychological symptoms, and it's mostly or frequently observed in those women who report having gone through physical, sexual, or other seriously psychologically abused by their male partner. So in case, like I said, we learn all this so that we take note of all this, so that when they come to the hospital or to the clinic, because I remember last week we learned that some of them, they will not report, but it's only when maybe you are doing the assessment, or you are assessing them. So that's why when we are assessing the woman, please, we shouldn't be in a rush. At least we should be assertive. I remember my tutor, he said a nurse must be assertive, a midwife must be assertive. So you should open your eyes when you are observing them or assessing them. So you shouldn't just, okay, mami, daho, peja wontumano and peja watadi. So at least we do head to toe physical assessment. Sometimes let's open our eyes so that we can ask questions when we observe anything unusual. Okay. So we have what triggers abuse in pregnancy. So particularly in pregnancy, what actually normally triggers abuse? At least we are saying that for a woman who is pregnant, dear, everybody admires a woman who is pregnant. So what may cause or triggers that? So pregnancy does not prevent intimate partner violence, but conflicting evidence exists about whether it increases or decreases during pregnancy. So actually, there is there's actually in research, there's actually a conflicting that is evidence that shows whether it reduces, maybe once the woman is pregnant, does it reduce or it increases? Okay. So may begin or intensify during pregnancy. So like we've talked about the reproductive coercion. So it depends. It depends on what the abuser wants. So if it's about pregnancy and you are not getting pregnant, that's another issue. But sometimes the abuser doesn't want the pregnancy. So this is where it triggers abuse. So when having a baby triggers unexpectedly negative emotions, from feeling jealousy to being trapped. So, some women, they use pregnancy as a trap so that the man will marry her, or the man will take care of her. So that's where sometimes it becomes intensified when the man is not ready, and then you become pregnant for her, or sorry, for him. In the WHO multi-country study on women's health and domestic violence against women, the majority of women who reported physical abuse during pregnancy have also been beaten prior to getting pregnant. So that's why we are saying that this thing is a pattern. So although around 50% of women in 3 sites stated that they were beaten for the first time during pregnancy. So, it's not every man. So that's why prenatal education is very important. And that's why it's unfortunately that in our setup of the world, because the way our ANC have been set up, but ideally the man is supposed to come along, or a family member is supposed to come along with a pregnant woman, so that we take the two of them or both of them through education. I was telling my students when I was teaching them normal pregnancy about like my own experience, because my first pregnancy happened when I was outside the country. And for them, when you go to their ANC, no pregnant woman comes alone. They either comes with their partner. Majority of them, they comes with their partner. We will see their partner beside them. If they don't have a partner, maybe they have their mother who is with them. Sometimes they even have the partner, the mother, the father, everybody, the whole family will accompany them to ANC. And you could see that in fact, even if the man is working, because they know the time they have the appointment, the man will leave whatever he's doing and then come and accompany the wife to the clinic. So, which is very, very important. Pregnancy may be a time of stress, upset because pregnancy was not planned, stress at the thought of financially supporting a family, and then jealousy that your attention may shift. So these are some of the things that trigger abuse in pregnancy. So maybe it's an unplanned pregnancy where the man is actually not prepared. But sometimes, because some of the women, they want to use it as a trap of getting money. And also sometimes financial wise, maybe the man may be thinking now a second person is coming who will need a diaper, who will need a baby wipe, who will need a napkin and the rest. And the thought of it even make him angry. And then he begins to abuse you. Then there's also jealousy, because there's also the fact that sometimes they think that their attention may be shifted, especially once the baby is around. The attention will be shifted. And sometimes because there's lack of education of sex